Today I am going to talk about this osteology bone, femur. So let's identify the side of the bone. So I would say this belongs to the right side. How did I say that? So you have to look for the head of the femur which is facing medially. This is superior-medially directed, and you can see the neck portion that's also medially directed. There is a greater trochanter and a lesser trochanter. Greater trochanter is this one, lesser trochanter is facing backwards. Okay, this is about the proximal end. When you come to the shaft of the femur, this is smooth. At the back you can see a line that is called linea aspera. This is linea aspera, means something that is rough. Okay, this is the distal end. You can see two trochanters. Okay, so this one is the medial one and the lateral one. So medial one is little bigger compared to the lateral one. So this is the medial one, this is the lateral one. So you see the difference. And also you can see there is a fossa depression, that is the popliteal fossa. So this is of right side because of all these reasons. So you can also hold it like this and try to balance, and it will be tilted medially. So that would say that it belongs to the right side. Now let's look at only the proximal portion of the femur. So it has a head, and right in the center there is a small depression that is called the fovea capitis, and this articulates, this entire thing articulates with the acetabulum of the pelvis to form the hip joint. And this fovea actually gives attachment to a ligament that is known as ligamentum teres. This is a small fovea. Ligamentum teres is attached to the acetabulum of the pelvis. So now this is of right side, and this angle, that is head neck, the shaft angle, head neck angle is about 135 degrees, or you can also call it as neck shaft angle actually, that is about 135 degrees. So this increases the range of movement. So let's see what are the structures that is attached to the greater trochanter. So greater trochanter gives attachment to these muscles: gluteus medius, minimus, piriformis and vastus lateralis. And this is lesser trochanter, and that gives attachment to a small, a very powerful muscle. In fact, even though it is not of much length, it is a powerful muscle that is called iliopsoas. Forceful contraction of this muscle results in avulsion fracture of the lesser trochanter. Same thing goes with this one. If there is a fracture of greater trochanter, it could be because of forceful contraction of the gluteus medius. Now we talked about two gluteal muscles. Where is the other one? So you trace this linea aspera. So there is a medial line, there is a lateral line. You trace the lateral line upwards like this. You will bump into a rough area that is called gluteal tuberosity, and that is for the gluteus maximus. So this is gluteus maximus, medius and minimus would be here, along with the piriformis and vastus lateralis on the front. So these are the muscles on the greater trochanter. Lesser trochanter will be giving attachment to only one muscle, that is iliopsoas, and this angle is about 135 degree. Okay, so now here you can see that there is increased range of movement because this is a ball and socket joint. And coming to the shaft of the femur, you can see the anterior aspect there is a bulky muscle, that is vastus medialis, and the medial side will be vastus medialis, lateral would be vastus lateralis attachment. And here on the back side, posterior aspect, you can see this line. You can remember 1, 2, 3 to know the names of the muscles. One will be for biceps femoris, 2 vastus, and 3 adductors. Okay, so if you trace it downwards, you will reach the distal end of the femur. Distally, you can see a fossa that is called the popliteal fossa, and then there is medially, this is the medial side on the distal end, there is insertion of adductor magnus here. Okay, along with the medial head of gastrocnemius. On the lateral side, there is plantaris along with the lateral head of gastrocnemius. So this is the popliteal fossa, and this covers the distal end of the femur. So anteriorly there is of course the patella bone here, which is forming the knee joint. It is part of the the patellofemoral joint. So here will be the patella. So this is about the osteology of femur.